Great to have you here with us today for a small interaction about near infrared imaging. A brief introduction. Dr. Mandeep Singh Malhotra is an immensely experienced surgical oncologist whose subspecialization is in head and neck and breast oncology. He has more than 20 years of patient treatment experience. Dr. Mandeep is currently working with the CK Birla Hospital, Punjabi Bagh in New Delhi, as Director Surgical Oncology, and has previously worked with Fortis Hospital, Vasant Kunj, as Senior Consultant and Head of the Department, Head and Neck and Breast Oncoplasty. Dr. Mandeep is amongst the most experienced surgeons in India in treating and operating advanced or recurrent oral, oropharynx, larynx, thyroid, orbital, and maxillary cancers. He is also proficient in performing transoral robotic or endoscopic surgery for oropharyngeal cancers and sleep apnea, orthognathic and facial reconstruction post-cancer or trauma mutilation. Welcome, sir. Uh, so recently, your research article that is near infrared imaging, a safe and non-invasive innovation, significantly decreasing the post-thyroidectomy hypocalcemia. This paper was published in the prestigious European Society of Medicine. Request you to give your inputs on the article, key conclusions, and how near infrared fluorescence imaging can impact outcomes in these procedures.
So basically, this article is about the use of near infrared imaging. So whenever we are looking at thyroid cancers or thyroid surgery specifically, so in thyroid surgeries, there are two important things. That is, if I look into the morbidity of thyroid surgery, one is that we have to preserve the parathyroid, and the other is the recurrent laryngeal nerve. Now, the overall data, if I look into the British Association of Thyroid Surgery, American Association, so around approximately 25% of there's an incidence of post-thyroid surgery hypocalcemia. And majority of this is due to uh, inadvertent either removal of parathyroid or there is a injury to the blood supply of parathyroid. And normally we say that within 6 months to 1 year, this would recover. But if it persists, then it is called as permanent hypocalcemia or there is a permanent injury to the parathyroids. And the overall incidence for that is around 7%. So 25% or 20% and even 7% permanent is a very, very high incidence. And this is a very significant morbidity which is associated for thyroid surgeries. So during thyroid surgery, there has been researches that you can use an ALA, you can use uh, methylene blue dye, but all that has gone into disrepute. Now, uh, the conventional method is the surgeons or the surgical team's experience that whenever we are looking at thyroid surgery, we'll be identifying parathyroid in depending on that this is a position, it's around or above or below the inferior thyroid pedicle, it is the position at superior parathyroid. How does it look like? It looks like a caramel color. So that is how we normally identify, we preserve that this is apparently looking at parathyroid, so we should preserve that. Now, parathyroid gland by itself, so there is a property of it that it gives autofluorescence. That is, when we are looking through a infrared spectrum. That is, we are looking at around a wavelength of 820 nanometers. The parathyroid would be fluorescent. So it would basically it it would be more prominent vis-a-vis the thyroid glands, the lymph nodes, the other adipose tissues, and all. So this, when I'm looking at a near infrared imaging, that is, I'm looking at a camera which I'm looking at a wavelength of 820 nanometers around. So I'll be able to see the parathyroid and it would be more prominent than other structures and I'll be able to preserve it. So when we looked into our data, so this is a case series of around 7 patients and majority of them were either completion thyroidectomy or a total thyroidectomy with neck dissection, that is with central compartments. And none of our patients experienced post-op hypocalcemia. We even did not give any calcium supplements to all our patients. And when we are looking at the literature, it says that we are reducing the incidence of post-surgery, post-thyroid hypocalcemia to near around less than 5% or even 1%. So that is how significant it is when I'm looking at using a near infrared imaging for identification and preservation of parathyroid gland during thyroid surgery, and also over the course, like my experience when I have started using it. So we've done three parathyroid surgeries in which we were so one was a parathyroid adenoma, which was right below the carotid, a very unusual position. So the other two were normal parathyroid adenoma. So patient, we were able to give a very small incision. Secondly, we were able to identify the parathyroid adenoma with the NIFI, and that also helped us to do a parathyroid surgery in a much better way and a very less morbid way. So this is why I really feel that since NIFI is now available, and it is the same apparatus which we use for sentinel lymph node biopsies, which we are using for flap vascularization, which we are using the ICG dyes. So using when we have such an apparatus with us, and then whenever we are looking at thyroid surgeries, and specifically open thyroid surgeries, so we have a very good alternative, a very good device to identify a parathyroid gland, and obviously to prevent a morbidity, the most significant morbidity of thyroid surgery. So that is what I feel should be used, and this is, I feel that it was a very good experience with NIFI. And yes, there are certain limitations. It's not that, so initially people had used NIFI, or there are articles in which uh, people started using NIFI, but they did not find it well. The reason was that for autofluorescence in a parathyroid gland to be functioning, the magnesium levels have to be normal, the vitamin D levels have to be normal. So these are certain parameters also when we look. If my patient it doesn't have normal vitamin D levels, so obviously the capacity of a parathyroid to develop autofluorescence will be limited. So that these were certain reasons why in some reports it is said that NIFI is not that effective. But if you cover up all these parameters, NIFI is really very effective.
Okay. Thank you, sir,